He gave 50,000, but he also said, if you can't get the first 5,000 for operations, I'll cover that. If you can't do this, I'll cover that. So ultimately, he gave more than 50,000, but I think the initial 50,000 came with really a good business plan, which was get an endowment, get people to participate, get it out to the public so that, you know, I know he knew he wasn't going to last forever, but there was a certain point where it has to be embraced by the community, and the community has to know what they've got. They've got a good product. They've got something that they can really, get, you know, buy into, get a return in an investment. So, you know, it's for all children. But in Hawaii, I think at that time, there was only one pediatrician, and you know, how can you serve the kinds of population, even though it was getting smaller? The native population was certainly had problems that were probably very solvable. It's just that, as we spoke about before, many people had their children at home, so they just didn't know what to look for. There was only one pediatrician, and he did really well. He came over and helped. So back to the plan, I think that Albert said, okay, here's 50,000, and you match it, you start an endowment, you know, he made little steps in an outline so that there was a way to go and a plan to sustain itself. And I'm very proud that, you know, in 100 years, everybody has sustained it in whatever way they thought correct by merging. That was one idea and one successful idea. And now there's a tri-hospital grouping that I think really supports not just Oahu, but Kauai and other hospitals that need to understand what the diseases are that are happening to children today. So I can see where both of them were very enthusiastic about starting a children's hospital and not attaching it to something, but starting something new and different and vibrant and as up to date as they could make it at the time. And I think today we're still a hospital that wants to have the best equipment, to have, you know, the best nurses, to recruit doctors that will stay and really have a vested interest in how the kids survive and just become good citizens. And I think Kapiolani and the Children's Hospital today do that. I think they do a really great job of being the only hospital in a very small state and serving the whole Pacific Basin.